Thank you all for joining us for today's open enrollment session. Open enrollment begins, it began February 12th and will end midnight February 23rd. That's a Friday. You have until then to log into the ICUBA enrollment portal, make your benefit elections, add or remove dependents, review your current elections, and of course, if you want to continue flexible spending, to make a new flexible spending account election for the benefit year that starts April 1, 2018. So I'm going to go over general benefit information for open enrollment, the changes, some of the big changes for the new plan year. I'm going to highlight the ICUBAcares benefits, places on the Fort Lauderdale campus where you can use your benefits, a little bit more detail regarding the new medical plan from ICUBA, and then some more in-depth information on some of the enhancements to the plan, a summary of the medical plan side by side. I'll give you high-level dental and vision information. Largely, none of those benefits are changing, and some updates on the employee wellness program, the incentive structure, life insurance, personal insurance options like AFLAC and Legal Shield, and then wrap up reminders, things you need to keep in mind for open enrollment, making those changes. For the new plan year, the big thing effective April 1 is the new NSU ICUBA plan, the $4,000, $8,000 deductible plan from ICUBA. And this slide is really intended to be a high-level summary, just general things that everybody would want to look at or should look at if they're considering the plan. The new plan is a silver level PPO plan designed by ICUBA for employees who want to cover their children or the family who aren't currently enrolled or are looking to reduce their current medical insurance premium. The plan is a higher deductible plan than our current preferred and premier PPO plans. So you're going to have a higher out-of-pocket liability with a lower premium in the employee children and the employee and family tier. So just a quick reminder, if you do have any questions and I'm going through, send them through to the chat function to the organizers, and somebody from our team will answer. Otherwise, when I transition at certain points, I'll open it up to everyone for general questions and let everybody ask questions at that point. The differences in the new $4,000, $8,000 PPO plan are primarily in your cost share. You're going to be assuming a higher out-of-pocket liability with an individual and family deductible of $4,000 individual, $8,000 family, and an out-of-pocket maximum of $5,350 individual and $10,700 for the family. Our current preferred and premier PPO plans have individual and family deductible of $2,000, $4,000, and an out-of-pocket maximum of $3,500, $7,000 for individual and family, respectively. Premium is lower in the new $4,000, $8,000 deductible plan, but catastrophic events or scenarios where your high utilization of your benefits, if you frequently meet your deductible, you may spend more out of pocket at the end of the plan year in the higher plan. So this isn't the right plan for everyone, but it certainly can have a lot of benefit for those folks who are primarily well care or preventive care utilizers of their benefits. They do not frequently go to the doctor's office. They don't regularly meet their deductible, can save money in premium, but there is that assumption of a higher liability in the out-of-pocket costs. The similarities in the new plan and our current plans, the new plan is a PPO plan, just like the preferred and the premier PPO plan. It is the same provider network. The access to prescription pharmacy benefit is the same for all 3 medical plans that ICUBA offers, and the copays are the same for all 3 medical plans. So you have the same prescription pharmacy benefit, same access to providers, and the benefits are the same. There isn't anything excluded on one plan that is included on another plan. A few folks have asked if the new plan is right for them. And unfortunately, that's not a question that I can answer for you. Everyone's medical needs are going to differ. And our team can't tell you if the plan is going to be right for you. But there are some tools that ICUBA has developed and has continually enhanced to help you get a better idea of how you'll utilize the benefits and what you will spend out of pocket. Ask Emma in the ICUBA enrollment portal has added a lot of benefit for the addition of a 3rd plan. I used the function, I put my information in there, I asked a series of questions about how I utilize my benefits when I go to the doctor, how often I see a specialist, and I got a relatively close out-of-pocket estimate for my my current year's utilization. So taking the same utilization and applying it to the new plan year, I got an idea of what my expenses would look like given the same utilization. So Ask Emma can really help you go through and make a decision. It's intended to be decision support. It'll review all 3 of the plans together. You can add or remove features. You could add in prescription copays, add in specialist, ER visits. You can customize the information that's analyzed in Ask Emma to your specific needs, and it uses our benefit plan information and the way our claims are processed at Blue Cross Blue Shield to give you an idea. Next steps, obviously, you're going to have to make elections in the ICUBA enrollment portal if you want to change any of your benefits, and flexible spending is required to carry forward to the new plan year. I'll get more into that a little bit later in the presentation. So now's a good time to log into the portal, take a look around. If you're interested in the new benefit, use Ask Emma and let that decision support tool help you with information that you might need to make a more informed decision about your benefits. Rates and enhancements, there's just a summary of the monthly rates here. I have this in more detail in a couple of slides, and the rate sheet is also separated on the open enrollment webpage with the summary, high-level summaries for each of the 3 plans. These are monthly rates, not per pay period. So the information that you see here is your total monthly rate per pay period is that number divided by 2. That's what will come out over the pay periods in the plan year. The HRA contributions are remaining the same for the current plans, and the amount will be the same as the preferred PPO plan in the new $4,000, $8,000 PPO plan. Advanced imaging enhancement is a new enhancement to the medical plans, all 3 medical plans, effective April 1, 2018. And essentially what's happening to advanced imaging right now until March 31st in our plan, if you have an MRI, PET scan, CT scan, and you have not met your deductible, when you go for that MRI, if it's a $900 MRI, you're going to have to pay $900 before any of the coinsurance would apply. Advanced imaging is deductible, then coinsurance. Deductible, then coinsurance. So if you haven't met your deductible, $900, you're going to pay for the cost of the MRI at $900. On April 1, that same MRI is going to be limited to a $500 copay. So the $900 MRI today on April 1 would be $500. The cool thing about the enhancement is that the benefit will be the lesser of the actual cost of the MRI or advanced imaging or the $500 copay. So if the actual cost of the advanced imaging is $350, you'll pay $350. If it's more than 500, you will only pay 500. So that's a nice enhancement effective April 1. There's also a generic statin prescription enhancement for eligible members who have met certain age and therapy requirements. You'll receive notification from Optum if you are eligible for the generic statin prescriptions at $0. Otherwise, it's not generally applied to all employees or members who may be taking the generic statins. And then there are some enhancements to the Blue Rewards program and the Rally Dollars through ICUBA. New incentive structure and coins will have value starting April 1. So if you have coins, don't cash them out yet. If you have any specific questions or need clarification on anything, there are comprehensive summaries on the open enrollment webpage of all of the benefits. All 3 medical plans, dental, vision, there's some AFLAC information. So everything, anything and everything that I could add is available in the open enrollment's webpage. There's an open enrollment resources box on the left-hand side, all PDF documents linked in. I'll bring up the page and show you in a few minutes. ICUBAcares benefits are benefits that are attached to all of the medical plans at NSU. And let me back up for one quick second. There was a question about dual enrolled. And the question is, what is dual enrolled coverage? What does dual enrolled mean? So dual enrolled coverage is a coverage option available for 2 NSU employees who are married or in a qualified domestic partnership and also cover children under the NSU plan. Essentially, what happens in a dual enrolled status is we combine, ICUBA allows us to combine the employee only coverage level and the employee children coverage level into one primary deduction. So you're not getting cheaper, it's not less expensive premium from the total coverage area. You're still paying the employee only and the employee children rate, but what happens is the deduction is combined into one primary. So one employee has the deduction monthly, and you lessen your out-of-pocket liability. When you cover employee only and employee and children, the employee has the individual deductible and out-of-pocket to meet, and the employee who covers the employee and children has the family deductible and out-of-pocket maximum to meet. So you basically lop off one of the deductible and out-of-pocket maximum requirements if you split it out. That get your question? All right, I will continue. The ICUBAcares benefits, awesome. The ICUBAcares benefits are applied to all and available for all of the medical plans that NSU offers through ICUBA. All of the medical plans are administered by Blue Cross Blue Shield, and they are all PPO plans. So the ICUBAcares benefits are enhancements to either removing deductible requirements for services or services that are no cost to covered members. So no deductible is required before you access your prescriptions. You just pay the copay based on the schedule, which I'll show you in a couple of slides. You don't have to meet your deductible first. If you see an in-network primary care or specialist, you do not have to meet your deductible before you either pay the co-insurance or the copay, depending on the plan that you're in. The same applies for physical therapy, occupational therapy, and chiropractic services. No deductible, only the copay or the co-insurance. You do not pay a deductible for urgent care or emergency room visits, and emergency transportation is not deductible limited, so you don't have to pay your deductible before. There are also benefits that are covered at no cost, and this is just a summary of the benefits on the deductible and no cost. The comprehensive summaries on our webpage have more information about what is covered at no cost and what is excluded from meeting the deductible. Blue Distinction Total Care primary care office visits, those are always $0 out of pocket. So if your primary care visit is a Blue Distinction Total Care doctor, you don't pay for that visit. It's $0. No copay, no coinsurance. Medically necessary routine labs that are performed at Quest or sent to Quest with the draw from your doctor's office, those are $0 out of pocket. Your annual wellness exam is always free, and it doesn't matter if it's Blue Distinction or not. And nurse case management from Blue Cross Blue Shield is free for pre and post care planning, coordinating home health care, PT, stuff like that. The ICUBAcares Pharmacy Benefit Advocate is a relatively new service that ICUBA, Optum, and the NSU Pharmacy have developed. And I will tell you more about that in a couple of slides, but that is free to access if you need help navigating your prescription pharmacy benefits. And of course, Blue Cross Blue Shield's care coordinators, the Essential Advocate, 24/7 access if you need help finding in-network provider or finding out how services should be covered. This slide, knowing is half the battle. It's really just highlighting some of the things that are helpful to keep in mind as you use your benefits. Using your benefits is something that you have a responsibility as a consumer to make sure that you're taking advantage of the benefits in the best way possible, and you also want to make sure that you avoid as much out-of-pocket cost as you can. Urgent care or emergency room is a great opportunity to save some money out of pocket. If you are able to visit an in-network urgent care center instead of going to the emergency room, you can save upwards of $400 or some odd dollars, depending on the plan that you're in, versus the emergency room copay and the urgent care copay. So you'll see in-network urgent care centers, the copays listed out per plan. 50 for the Premier, 30 for the Preferred, 70 for the new plan. The emergency room copay is $300 for the Premier and the Preferred, and $500 for the new plan. So that's a significant difference in out-of-pocket cost for an urgent care versus ER visit. Obviously, if you need to go to the emergency room, you go to the emergency room. The out-of-pocket cost isn't the most important thing, but if you can visit an urgent care center instead of the emergency room, if it's not that type of a situation where you need to go to the ER, you know, you're able to do urgent care, it's going to save you out of pocket. You can find in-network providers. Blue Cross Blue Shield My Health Toolkit is available through the ICUBA single sign-on, and you can always call the Essential Advocate, the care coordinator at Blue Cross Blue Shield, to find an in-network provider. It's not a bad idea to have a couple locations handy in your area. If you're able, you can go and save a little bit of money out of pocket. The ICUBAcares Pharmacist Advocate. And I mentioned this on the previous slide. This was a program developed by the NSU Pharmacy, the pharmacy program, ICUBA, and Optum RX, our pharmacy benefit provider, to create a real patient advocate for the pharmacy benefit program. It's one of the areas where members have the most confusion. They don't understand how pharmacy benefits work, what is required for prior authorization, step therapy. That's what the ICUBAcares pharmacist is there for. They will help you review your prescriptions. You need help determining if you can go from one tier, from a brand to a generic. If that's something that you're interested in, they can help you review. They'll explain to you and help you with prior authorization, documentation for step therapy, and quantity limits. So the ICUBAcares pharmacist, 877-286-3967. It's free to use for members covered under an ICUBA medical plan, and they can help. They can even help you find manufacturers' coupons in the event that generic alternatives are not available. So if there are If there are manufacturer's coupons, you can't switch from the brand to the generic, or there isn't a generic available. If there's a manufacturer's coupon available, they'll find it. Telemedicine through Teledoc is not a new service for the new plan year, but it is relatively underutilized in terms of the benefit that it can provide. Not intended to replace a primary care physician, really intended as a supplement for quick visits for routine things like the flu or bugs or anything along those lines, where not chronic conditions. You're not feeling well, you might need antibiotics, you might be coming down with strep or something along those lines. You can set up the account, link your mobile phone, speak to them on the phone, and have a video session or images back and forth to the healthcare professional, diagnosis, and they can send prescriptions for non-controlled substances. They can send prescriptions to local pharmacy or pharmacy while you're traveling. It's a $5 copay. You can even set it up to pay with your ICUBA MasterCard. You've got to register a little bit. It takes about 5 minutes. You need the ICUBA is the company code. You need the company code when you register online. And once you do, single sign-on is available through the ICUBA enrollment portal. And before I advance, actually, I'll go over this slide and then I'll open up for questions to the group. ICUBAcares benefits. This is a highlight of additionally benefits that do not cost out of pocket. Just a little bit more information on the stuff that's $0 copay. Through Quest Diagnostics, those lab tests, pap tests, urinalysis, colorectal screenings, prostate screenings, those labs are $0 out of pocket. And an enhancement to the in-network labs. Currently, in-network labs are subject to, if they're not performed at Quest, they're subject to your deductible and then coinsurance. On April 1, lab tests that are performed at an in-network physician's office and not sent to Quest will be subject to the coinsurance. You don't have to meet the deductible first. So that's a nice enhancement if anyone does experience those cases where the labs can't be done at Quest or their physician needs to do them in office and they're not network. They're in network. For the medical plan, for Blue Cross Blue Shield, electrocardiograms, echocardiograms, mammography, colonoscopy, sigmoidoscopy, immunizations for adults and children, bone mineral density test, ultrasound of the breast, and of course the primary care Blue Distinction total care visits. Those visits are always $0 out of pocket. The Employee Assistance Program is available through our behavioral health provider, Aetna. Resources for Living is their subsidiary, and the Employee Assistance Program is available to all NSU employees, and every member of their household can provide up to 6 free counseling sessions per issue per year. And that's available again to every employee and every member of their household, regardless of their participation in or eligibility for a medical plan at ICUBA. The pharmacy benefits under Optum Rx that are $0 out of pocket include diabetic supplies like meters, lancets, test strips, control solution, the needles that are necessary for, the syringes that are necessary for injection, prescribed aspirin for adults, and generic folic acid and prenatal vitamins for maternity. The generic statins are also $0 out of pocket for eligible participants. And I will open up really quickly. I will unmute everyone. If you have any questions, be happy to answer, field anything now. If you don't, I'll put everybody back on mute and proceed. Any questions?
Hey, Josh.
Yeah.
I have one question / clarification about the dual enrolled.
Sure.
Does it mean that one employee pays for the dual enrolled price and the other employee pays the individual price?
No. So the dual enrolled is one employee pays the dual enrolled price and the other employee waives their election and they don't pay. So the employee who takes the dual enrolled election takes the entire election, and you knock off that extra. Right now, out-of-pocket maximum and deductible are on a family side. It's the first 2 members, so you have to meet it. The individual you have to meet twice. If you are dual enrolled eligible and you don't dual enroll, you've got the family side for the employee and children, and then you've got the employee only who's covered with the extra deductible and out-of-pocket max. So combining them lets you limit your out-of-pocket liability.
Okay, thank you.
No problem. Any other questions? Ask Emma on the ICUBA website just popped up. When you log in to make your open enrollment elections, you have the ability to enroll with or without audio and start Ask Emma. Ask Emma, the logo is in the ICUBA enrollment portal, and it's usually on the upper part of the navigation window. If you can't find it once you're in the system, send us a quick note. We'll send you back a screen grab just so you know exactly where to click.
You sure?
Any other questions? And I will mute everyone and then proceed.
Here's more. Look at this.
All right. So highlights for using your ICUBA benefits, your NSU ICUBA benefits at NSU. This slide is really just informational. It's places on the Fort Lauderdale and North Miami Beach campus where you can use your benefits. They're in-network providers. The Medical Health Center is an in-network provider. Blue Distinction Total Care for some of the providers. So if you're seeing Family Medicine or the Employee Health Center, Blue Distinction Total Care providers. The NSU Clinic Pharmacy is an in-network pharmacy through OptumRx. There are 62,000 network pharmacies nationwide. That's independent and chain pharmacies. The NSU Clinic Pharmacy on Fort Lauderdale campus is in network. The Psychological Services Center is in network. So you could use your Aetna card for behavioral health and substance abuse. And of course, the Eye Care Institute is in network for the vision, the contact lens and glasses benefit. The dental faculty practice is in network for the PPO dental plans only, not the HMO plan. So you would not be able to use your HMO dental benefit at NSU. Anywhere that you have eligible expenses and you have either the medical with the HRA election or you've elected flexible spending, you can pay those expenses with your ICUBA MasterCard. If you enroll in Dependent Care Flex, you can also use the ICUBA MasterCard at Mailman Siegel Center and at the University School for Camp Nova. It's not eligible for tuition, but for aftercare, gap camp, stuff like that, Dependent Care Flex can be used. A question popped up, and while I'm on the slide, I'll just go ahead and fold it in. The ICUBA benefits card can generally be used for any eligible medical expense as long as it is not a cosmetic in nature. So LASIK would be an example of a covered benefit. It's not considered cosmetic. An example of a cosmetic procedure would be teeth whitening. LASIK is an eligible expense. For the medical plans at NSU, this is a high-level summary. I mentioned the comprehensive summaries that are on the NSU webpage. Let me see if I can pull that up really quickly and just kind of show you the webpage real quick. Give me one sec. So this is the open enrollment webpage. It's a dedicated webpage for open enrollment resources. I'm going to type that into the chat bar so that everyone has it. Make sure I spelled that properly. The open enrollment webpage on the left-hand side, the open enrollment resources box has summaries for all of the information, the presentation. The rate slide is separated out, so if you just wanted to jump into the rate slide really quickly, it's there. Summaries for each of the medical plans. There's several pages of information here. It goes in detail about what's covered, how it's covered, some information from Optum, and additional summary descriptions of each of the medical plans. So those summaries are all in the open enrollment resources box, and then the presentation is available in an HTML5 flipbook, and more information on the upcoming open enrollment fair, the ICUBA portal, all on that page, quick, easy to access. This is the high-level summary, just meant really for information to give you a quick visual on how the plans are structured with the premium at the bottom. The area in the center that is in the blue dotted box, this area here, these are benefits that are the same for all of the medical plans. So you'll see the Premier, Preferred, and the new plan in that order. The green is the Premier, the Preferred is the blue, and the 4,000, 8,000 is the orange. You can see the difference in deductible and out-of-pocket maximum between the two, the current plans and the new plan. The copay structure is listed for some of the basic, more frequently used services, and the coinsurance that applies for specific access like hospital, things like that. When you're looking at the new plan, if you are looking at the new plan, just keep in mind the greatest benefit in the plan is for the employee and children and the employee and family tier. There isn't a whole lot of premium savings on the employee only side or the employee and spouse side. So you may not want to assume that extra out-of-pocket liability for an additional $5 or $7 a month in premium savings. If you do, and absolutely that $5 or $7 can be valuable to to everyone at the right time, if the lower premium is worth the additional out-of-pocket risk, again, if you're not regularly utilizing your benefits, it's primarily well care, preventive visits, and you need to save the difference in premium, you can definitely look at the new plan, but keep in mind you're assuming that higher out-of-pocket liability. Where you see the biggest benefit is the employee and children tier and the employee and family tier. For employee and children, there's about a 43% differential. The premium's about 43% lower than the preferred plan on a monthly basis, and about 20% lower on a monthly basis than the family and the preferred. So absolutely could have value for some folks, but make sure you take a look. Question came up relative to podiatry services. Podiatrists are considered specialists, so it would be a specialist office visit. And in-network podiatrists, you can contact the ICUBA care coordinators, the Blue Cross Blue Shield Essential Advocate, or search providers through the single sign-on. The prescription pharmacy benefit I mentioned is the same for all of the NSU ICUBA medical plans. Each plan, exactly the same. So the copays that you see here are the same copays for the Preferred, the Premier, and the new $4,000, $8,000 deductible plan. What I'll highlight are the 30-day supply, just so I don't have to go through each row and column. Preferred generics at the NSU pharmacy in Fort Lauderdale are $0 out of pocket. So if you're able to visit the NSU pharmacy, you can get your preferred generics for free. Retail, those generics are $5. Non-preferred generics are $10. and your preferred brand and non-preferred brand are $40 and $75 respectively, and that is for a 30-day supply. Specialty medication only generally is only dispensed in 30-day supplies and is fulfilled through Briova. If any of this on screen is confusing, or you're taking specialty medication or preferred brand or non-preferred brand, and you want to look at switching to a non-preferred generic to lower your out-of-pocket cost, this is where the ICUBAcares pharmacist can help you. They can help you navigate each of the tiers, figure out if your prescription drug benefits are, if your particular prescriptions are transferable, if something is available in a generic alternative, and even, like I said, even help you with manufacturer's coupons if it isn't. But if you are taking specialty medication, or you may need to take specialty medication, they can help you with the process. It's not, specialty medication specifically is not as simple as dropping off the prescription and picking it up. Some of those prescriptions will only be delivered to a physician's office or a nurse practitioner, or a PA, so you can't pick it up and take it somewhere. Some of them are controlled substances that require very specific handling and storage. If you need assistance with this benefit, the ICUBAcares pharmacist walk you through all the steps, help you with prior authorization, help you with the step therapy requirements, and really help you utilize your benefits. Optum Rx and ICUBA also negotiated a dedicated Optum customer service center. So if you call Optum directly for customer service, you have issues, you can't, something's not right, they should be able to help you relatively quickly. They are dedicated to ICUBA. They understand how our group works and how it's built, and should be able to help you navigate quickly. I mentioned the ICUBAcares pharmacist. It's a great resource, doesn't cost you anything, and they will help. Again, quick reminder, available for all of the medical plans and any covered members in the medical plan. Behavioral health coverage is provided by Aetna. Aetna's subsidiary Resources for Living also does our EAP, so it's the same number for both services. Behavioral health coverage that is available includes professional counseling services, psychiatric medication evaluation, ABA, applied behavioral analysis therapy, intensive services like rehab, detox. Those services are all covered under our behavioral health benefit through our medical. I'm going to highlight the differences between the three that I've mentioned so far, medical, prescription, and behavioral health, in a couple of slides. You'll notice some of the slides have pictures of your member ID cards. There's a specific reason for that, and a reminder that I will give everybody in just a couple of slides. Again, EAP is available for all employees. You don't have to be enrolled in a medical plan at NSU, and every member of your household. So if you have reason to, or know anyone in your household may need these services, they can use them free of charge. This slide is a side-by-side highlight of the benefits that are provided by Aetna, and Resources for Living is the EAP. The behavioral health is provided, so you don't pay to access any of the services. EAP is free for all employees. Behavioral health services are attached to medical. There's no cost to access. You would just pay the copay or coinsurance depending on the type of service under your medical plan. And then new from Aetna is able to condition management. This is an enhancement to their service, and it's for employees and their eligible dependents diagnosed with specific conditions. The benefit is also available to excuse me, to those diagnosed members' caregivers, and the caregivers do not need to be covered under an ICUBA plan in order to access this benefit. It's an education and resource benefit intended to support those folks who are providing care to specific diagnosis under the behavioral health plan. You can call Aetna at 877-398-5816 to verify provider, network, access the EAP, and find out more information about ABLE2. Option 1 when you call is for the EAP. Option 2 is for the behavioral health services. A question popped up about speech therapy, and what I will do very quickly is go back into the open enrollment webpage and just pull up the summary. Speech therapy is covered. Outpatient speech therapy is on the, I just brought up the Premier plan. It's 0% after the copay. So it's a copay. If we looked at the preferred plan for speech therapy, it is 20% of the contracted rate, not subject to deductible. And I'm assuming that the new plan also has a copay attached. It is probably the $50 or $70 copay for speech therapy. So the short answer to the question is speech therapy is covered for outpatient speech therapy. And in the summary at the end of the page, looked like there's some additional information on speech therapy for up to 60 combined visits. So these comprehensive summaries are a good place to look for quick questions on specific things and how they're covered, if they're covered. Flexible spending is, and you know what, before I do flexible spending, I will take everybody off of mute very quickly. Everyone is off mute. Anyone have any other questions or anything up until this point? No questions for me? All right, I will mute everyone and then proceed. If you do have questions, you can send them to the organizers through the chat, or if you think that the question is beneficial to everyone, send it to the entire audience. But if you want to keep it private, just send it to the organizers. For flexible spending, this is the area that I love the absolute most. On this slide, highlighted the HRA, Healthcare Flex, which is the HCFSA, and Dependent Care Flex, the DCFSA. The HRA on the left with the blue header is the monies that are attached to your medical election and provided automatically by NSU when you're enrolled in medical coverage through the university at ICUBA. HRA deposits are made starting with your second month of participation in a plan and continue as long as you're enrolled. So at the end of your second month, if this is your first time coming in during open enrollment, you'll get your first deposit at the end of May, and your deposits will continue every month depending on the plan that you're in. It's either 25 or 50 in the Premier plan. So the employee only gets 25. Every other tier gets 50. So spouse, children, family, $50 a month. On the preferred and the new 4,000, 8,000, it's $50 for employee only, and then $100 for the different tiers. So if you're in family, you get 100. If you were in employee and children, it's 100. That'll continue every month. There are no deductions associated with the HRA. It's tied to your medical election. You don't have to take any specific action in order to enroll in an HRA. It will happen when you make your medical election. It can be used for medical expenses, eligible medical, dental, vision, pharmacy expenses for you and any member covered in the ICUBA plan. If your dependents or your spouse or domestic partner are not covered under the ICUBA plan, you cannot use the HRA funds for those dependents. If you elect healthcare flexible spending and you are participating in a medical plan with the HRA, flex funds are used first because they are use it or lose it benefits, and the HRA funds are used after you exhaust your flex funds. HRA rolls over every year. Some examples of how you can use your HRA. It's the same as the Healthcare Flex: eligible medical expenses, healthcare RX copays, dental and vision care, durable medical equipment. Again, those are for you and the covered members in your medical plan. Healthcare flexible spending and dependent care flexible spending do not require your participation in a medical plan. So if you're covered under a family plan elsewhere, a parent or a spouse's plan, domestic partner's plan at another organization, you can still enroll and elect flexible spending to offset your medical expenses or flexible spending for your dependent care, your pre-care, aftercare expenses. You don't have to enroll in medical, you only have to be eligible for medical. Eligible for medical is benefit eligible, at least 28 hours per week, designated as benefit eligible. If you're not sure, check with your supervisor and the HR contact. They'll let you know if you're benefit eligible or not. Healthcare flexible spending account elections are annual elections that you make during open enrollment. You contribute to the plan throughout the plan year. That's from April through March, 24 of the 26 pay periods. So all of our medical, dental, vision, flex elections, they're deducted over 24 out of the 26 pays. There are 2 pay periods twice a year, in different months every year, where we get paid 3 times. We have 3 pay dates in a month. That third pay date in the month, we don't have any deductions taken for medical, dental, vision, or flex, and any of the other optional benefits that we might have. So the third pay period is no deductions. If you don't see them on the third pay date, it doesn't mean your benefits were canceled. It just means it's the third pay date. They don't come out. Healthcare flex, dependent care flex are deducted over those 24 pay periods. The difference between healthcare flex and dependent care flex, the healthcare flex election is advanced. So if you make a $1,000 election during open enrollment on April 2nd, you'll have access to that $1,000 for use for eligible medical expenses for you and any eligible dependent in your family. If you enroll in flex, the annual limit, and it's an individual annual limit, meaning you and your spouse or domestic partner could also elect the same amount, $2,650. Dependent care flex is a household limit. It's a $5,000 household limit. So if you elect $5,000, your spouse or domestic partner can't elect another $5,000. Your combined limit is $5,000. When you go to file your taxes at the end of the year, you're going to get an error. You're going to have to do some adjustments because you over contributed to dependent care flex. So if both parents or both of the providers in the family are contributing to dependent care flex, you want to take a look and coordinate with your partner on that one and make sure you're not over contributing. So healthcare flex is advanced. Dependent care flex is available per pay period. Healthcare flex is for medical expenses, medical, dental, vision, pharmacy, etc., for you and any eligible dependent. Dependent care flex is for daycare, pre-care, aftercare, gap camp, summer camp, stuff like that, for dependent children under the age of 13 or adult disabled dependents with a documented disability through SSA or SSI, and care for them is required to enable you to work. So it's a very different type of flexible spending benefit. Every year, we have folks enroll in dependent care flex who do that for medical expenses for their dependents. That's not what it's for. It's for care for children under the age of 13 or adult disabled dependent care to enable you to work. So dependent care flex funded each pay period. It is not advanced, and it is subject to the same use it or lose it rules as healthcare flex. The use it or lose it rules are when you make an election during open enrollment, that election is effective April 1. I'll use our upcoming plan year as an example. April 1, 2018 for our elections made during open enrollment. The benefit period is April 1, 2018 through March 31, 2019. And we can incur expenses on that election until June 15th, 2019. So from April 1, 2018 until June 15th, 2019, any eligible expenses that we have incurred can be submitted for reimbursement or paid for with the ICUBA card until June 30th of 2019. Any unclaimed expenses or expenses that have not been paid for with the ICUBA MasterCard or submitted for reimbursement are forfeit. So you have 15 months to utilize and submit claims on Healthcare Flex and Dependent Care Flex. Use it or lose it benefit, it is a pre-tax benefit. On the medical side, this can have a particularly big advantage if you know that you have treatment coming up after April, on or after April 1st. If you're planning orthodontia for the new plan year and you want to start paying for the treatment, Healthcare Flex will be available to you. The Medical Flex will be available on April 2nd so that you can have access to it and use it as you wish for your eligible medical expenses. The strategy that I take with my Healthcare Flex, I elect what I think I'm going to need for the plan year, and then my smaller expenses I hold on to. So if I go to the dentist or I pick up some prescriptions, I will pay those out of pocket and let them accumulate until I get to the end of the plan year. If I don't have any big expenses come up, then I'll submit all of the receipts and treatment that I've received for the current period, the current election period. That way, I have the ability to use the funds for bigger stuff. If I needed to go to the ER, or if I had to pay down my deductible or anything like that, I've got the funds there. If and at the end of the year, I submit for reimbursement, I'll get everything back, within a couple of days of submission. But it gives me the flexibility on the medical side to balance out how I manage that money in case something comes up. From the Dependent Care Flex side, it's a little different because it's not advanced. You're paying either out of pocket and submitting for reimbursement or using the card at the provider. I mentioned Mailman Siegel University School for Camp Nova. You can swipe the card there, but not all aftercare or pre-care providers will be on the database. I've had kind of a mixed bag in terms of where I can use it. My aftercare program that I did last year, no problem. The school, no problem. But there was a specific program they weren't in the database. I had to pay and submit for reimbursement. So any of these elections can be added if you have a qualifying event. So if you have the birth of a baby, for instance, or are coming into the plan, you lose eligibility and you're coming into the plan, you can make these elections outside of open enrollment, but the open enrollment period is your opportunity to make these elections without the necessity to provide the qualifying event documentation. So you can add the benefit now without supplying any necessary documentation. But of course, if you do have an event after the open enrollment period closes, you're going to deliver April 15th. The delivery date, the birth of the baby, gives you a qualifying event to add and change certain aspects of your benefits. They have to be consistent with the type of change, but yes, you can. So I'm going to just open up really quickly. I'll unmute everyone. Any questions other than what's come up on flexible spending or HRA? I do see a question that came up on how do I tell what is NSU funded and what is HCFSA. When you're in the ICUBA enrollment portal and you access the single sign-on for the ICUBA MasterCard, you can look at your account summary and there will be HCFSA that would be your flexible spending account election. If you did DCFSA, you would also see that. The HRA, for some reason in the ICUBA enrollment portal, it is called HRP instead of HRA. I don't know why there's a discrepancy in the acronym for the account, regardless of what the actual name of the account is. But the HRP is the HRA. So if you were to log in to, let's see, to the ICUBA enrollment portal, when you're in the portal, you're going to see, and this is the role that you'll see as an employee. When you log in, the other screen was my manager access. If you have not started your elections, it'll be green if your elections have been started, or if somebody from our team has helped you get through, it'll be orange and ask you to continue your elections because you can make changes until the 23rd. The portal, the single sign-on, is right in the center. Let me get the highlighter out here. Right in the center under My Carrier Accounts, this area. And when you click on the ICUBA MasterCard account balances link, it's going to give you, it's going to pop you into the administrative site. You'll be able to check your accounts details or summary, and the summary will give you a quick dependent care flex, flex spending, and HRA. They're all split out, so you can see each benefit designation. If you only see the health reimbursement plan, that's the university funds. If you have dependent care flex or flex spending, those are monies that you're contributing. And that's right here under My Carrier Accounts, the ICUBA MasterCard account balances. You can also click on the little ICUBA MasterCard on the right-hand side. It'll take you right in. Question came up about separation. Are you still able to use your HRA or FSA funds for previous month's expenses, or do those funds cease upon termination? So it's a good question, and the HRA funds are portable after 36 months of continuous participation in a medical plan. So if you've been enrolled in a medical plan for 36 months and you have an HRA balance, that HRP, in the portal, those funds will be available for use after separation for eligible medical expenses. If you have flex or dependent care flex, you have 90 days after separation to submit any claims for expenses that you have incurred up to your last day of work at NSU. So you can't submit anything after your separation date, but you do have a 90-day window to submit any unclaimed expenses that you have incurred up to your date of separation. Why do I have so many cards? You're very welcome. You have so many cards because the benefits at NSU are administered separately and attached to medical for the images that are on the screen. When you make a medical election, at NSU through ICUBA, the prescription pharmacy benefit is attached to that medical election, but administered by Optum. When you make a medical election, the behavioral health and substance abuse benefit is attached to the medical, but administered by Aetna. And of course, if you make a medical election, you're going to get the HRA, which is available for use on the ICUBA MasterCard. So your medical election is going to kick off 4 cards. Keep that in mind, because you need each of those 4 cards to access different parts of the benefit. If you take your Blue Cross Blue Shield card to a pharmacy, you're not going to show up as being covered under a pharmacy plan at Blue Cross Blue Shield. Your pharmacy benefits provided by Optum. If you take your Blue Cross Blue Shield to a behavioral health provider, they are not going to be able to tell you if you're in network for Aetna. They may be in network for Blue Cross Blue Shield, but Blue Cross Blue Shield does not administer our behavioral health benefit. Behavioral health has always been, and pharmacy have always been separate. Behavioral health transitioned to Aetna 2 years now. Prior to that, it was a different administrative company, but separate. So looking for providers, contact Aetna directly. Need pharmacy benefits, use your Optum card. Medical care, ophthalmologist, specialist office visits, podiatrist, stuff like that, your Blue Cross Blue Shield card. If you do not have any of these cards, you can access them through the ICUBA enrollment portal through the single sign-on. You can get your ICI number, your Optum number, and your Aetna number. When you log into the enrollment portal, it'll actually be available on the lower left-hand side of your screen. You'll be able to get those numbers and request cards. Dental and vision, largely the same this year. The premium did increase on a couple of the tiers, but not across the board. So some of the benefits have stayed the same. Some of the benefit premiums have increased a little bit. You can view the current premium and the new premium in the ICUBA enrollment portal. The iMed Vision plan, we still have the base plan and the buy-up plan. The difference between the two, on the base plan, you can get exams and lenses every 12 months, frames every 24 months with a $100 allowance. On the buy-up plan, it's exam and lens every 12 months and frames every 12 months with a $130 frame allowance. And the frame allowance can be used in lieu of frames for contact lenses on either the base or the buy-up. The in-network benefit is listed. The monthly premium is listed. Again, remember, the per pay period amount is that amount divided by 2. And if you're looking for in-network optometric care, or you wanted to get glasses, the Eye Care Institute on the Fort Lauderdale campus and North Miami Beach are in-network providers. You can use your benefits there, part of the Insight network. If you're not able to get to a brick and mortar contact lens or optical dispensary and you've had an eye exam, you can use your benefit through iMed's subsidiaries, contactsdirect.com or glasses.com, to order prescription frames or contact lenses. The summary, again, available on the open enrollment webpage, where you can go through and check out more comprehensive information about what is covered. If you go out of network, what you would need to do for submission. Humana Dental, the same plans are offered this year. It's the dental HMO, preventive PPO, and the high coverage PPO option. Important to note, for the dental HMO, it is only available in the state of Florida. The preventive PPO is preventive and basic services only, does not provide major service coverage. If you want major service coverage, you're looking at the high coverage PPO or the HMO. Preventive and high coverage PPO plans are accepted. They pay the same in and out of network. So if your dentist is out of network and you're in the preventive or the high coverage, your benefit's going to pay the same. If you need additional services beyond your out-of-pocket limit on the PPO plans, you'll see a greater benefit in network. Additional discounts are generally subject to provider discretion. They do not have to give a discount. The HMO plan, again, Florida only. There is no maximum on the benefit. It's based on the co-pays for covered services, and the co-pays are in the Humana summary on our open enrollment webpage in the resource box. The HMO and PPO information is in the same PDF document. Employee wellness, it's been 2017 was a great year. Employee well-being and wellness, it's really our mission. It's what we do at the benefits department. And last year, business was pretty good. Ronina spearheaded 97 wellness events campus-wide. Pat, Ermi, Doug, everyone on our team, members of the Strategic Business Partner Group, our HR contacts, everybody helped make this happen. 97 events, 4,328 attendees. Ronina has boosted rally participation through active engagement of everyone. 2,924 people participate in rally. That's more people than I have go through the open enrollment process every year. That's amazing. So people are participating in their wellness. They are out there earning the ICUBA dollars. This 2017, more than $300,000 earned by NSU employees and their eligible spouse or domestic partner. And the health fair, the annual health fair 2017, best yet, highest participation, great vendor participation. Everyone did a great job in attendance. Everyone did a great job in organization. It was a fantastic event. If you weren't able to attend last year, please try and join us this year. We also did a health fair in Tampa. Second year in a row. We're planning to expand when we can to some of the other regional locations. So, you know, kudos to Ronina and the entire team and everyone who's helped make this happen, and to all of you who have helped make this happen. Your participation is every bit as important as what we're doing here. Thank you. The rally program that Ronina uses to help drive engagement in the wellness and well-being program that we do here is changing. ICUBA is changing up the structure a little bit. You'll see that the incentive structure on screen is changing. The annual total that can be earned is being reduced from $450 to $250. Part of that is ICUBA did not anticipate the utilization. I don't think that anybody anticipated the utilization of the program the way that it has taken off, and they want to be able to sustain it. So they've got to scale it back a little bit, and they've done that in a couple of ways. One of them is coin value. So coins are now going to have actual value. It's kind of cool. If you haven't been cashing out your coins, don't. Sadly, I wasted all of mine trying to win Amazon Echoes and Google Homes, and I did not win. If you do have coins, save them. They're going to be worth something. You'll be able to either bid on items after April 1, on April 1, or if you don't like gambling or prefer not to gamble, you can bank your coins and use it like a buy it now feature. The cool thing about the auctions, if you use your coins and you don't win the auction, you're going to get your coins back and your balance will keep growing. The coins will have technically an unlimited value, and you can even donate them to charity for actual cash value and make an impact with your coins if you're not using them or you don't want to do anything with them. Also, you'll see for the incentives, there's coins and sweepstakes, and these will vary depending on the activity. But when you hit a certain milestone or you perform a certain action, ICUBA is going to draw every 14 days a $50 Amazon gift card winner. There's no limit on how many times you can win, and if you hit X number of milestones in that period, you'll be entered X number of times. They're only going to draw one winner, but you could rack up 4 or 5 entries for a specific period. The cool thing about the sweepstakes, it's not open to that large rally group that we've currently been trying to win against with our coins. It's a much smaller group. We've got about 15,000 total, but that's going to be limited to the participants who actually complete the survey and are active in the system for the drawing. So it's much more likely that NSU folks are going to win, especially considering we've got a lot of people participating. So it's nice when our folks win, and it's even nicer that we can win frequently. I think it's a nice enhancement, and it will be a lot of fun. Personal insurance, this is AFLAC Legal Shield. I'm not going to go into too much detail because AFLAC is something that is individually underwritten. If you're able to join us at the benefit fair UPP on the 22nd, the PC lab and lobby, 8:30 a.m. to 5 p.m. Joe Evans is going to be there. He will give you the nuts and bolts. There's also an AFLAC summary on the open enrollment page with rates and some of the highlights of the plans that are available at NSU. You can also call Joe directly if you can't come out and see him, 560-6000. I inadvertently had his fax number wrong, so if you know anybody who's been trying to contact Joe calling his fax number instead of the cell phone number, please let him know that the number's been corrected. It's 560-6000. Joe will get you enrolled. He'll give you all the information, tell you how the plans will benefit you, very straightforward about how you can utilize and take advantage of the benefits. It's an opportunity, though, to offset your deductible and out-of-pocket expenses during the plan year. This could be particularly valuable if you're looking at the new plan, or even if you're going to stay in the Premier or the Preferred plan. $2,000 individual, $4,000 family deductible is still a lot of money to come out of pocket. And this is an opportunity of ways that you can save or mitigate those out-of-pocket expenses with personal insurance through AFLAC. Give Joe a call. He can help you. Legal Shield, ID Shield. This is an optional benefit. You don't have to do this during open enrollment. You can actually do this anytime throughout the year. You can add Legal Shield coverage. But if you're going in and you're going to be in the portal anyway, not a bad idea to take a look. Legal Shield services, personal business legal advice, letter writing, professional legal letter writing to your HOA, stuff like that. They'll help with living will, document prep, and the ID Shield provides privacy monitoring, security monitoring, and full service restoration if you have an event under ID Shield. If you have pre-existing identity theft issues, they will not assume full service restoration. They can help you restore, but they will not assume responsibility of the pre-existing ID theft. If you have any questions, Kelly's not going to be at the benefit fair, but Joe will have her information there, and he'll be able to answer any general questions. Life insurance, two options at NSU. There's group term life and group whole life. The group term life is age-banded term policy. It's rate reduced at age 65 and 70 with a maximum coverage amount of $300,000 before the reduction. There are options available for spouse and domestic partner. If you're making term life changes during open enrollment, once open enrollment closes, we're going to send you a reminder about the EOI requirement. So if you increase or add term life, you have to provide an EOI. Once open enrollment closes, we'll send you the information and the instructions and information on how to finish the EOI. Whole life through MassMutual is a whole life individual policy. It grows cash value, and for open enrollment, new elections, they have to be completed with MassMutual and undergo medical underwriting. Life insurance changes for term life. I mentioned the EOI. We're going to send everybody the form after open enrollment closes. If you don't return the form to Reliance Standard by March 31st, the election will be canceled. Open enrollment is your opportunity to make changes to your benefits without any documentation requirements. It's your open period to do whatever it is that you need to do, and add, remove dependents, make flexible spending account elections. A reminder that all of your elections will carry forward with the exception of flexible spending. If you do not enroll in flexible spending during open enrollment, you will not have access to the benefit on April 1. That applies to any of your benefits. If you're not if you do not go into the portal for open enrollment and make election changes and decide that you want to change them after the open enrollment period, you'll have to have a status change, life event defined by Internal Revenue Code Section 125, or wait until the next open enrollment period. Eligible dependents, an eligible dependent for participation in NSU benefits through ICUBA, and you have to affirm an eligible dependent. If you have dependents in the system, even if they're not covered, you have to affirm eligible dependents. They remove them from ICUBA's system on our side. Legally recognized spouse or domestic partner, a natural child, legally adopted child, stepchild or child required to be covered by a qualified medical support order. Also foster child and a child who resides with you, with whom you have legal guardianship of. Those are eligible dependents. Parents, grandparents, niece, nephews, not eligible dependents have to be on this list in order to be considered an eligible dependent. Children are eligible dependents until the end of the calendar year that they turn 26. If you have an adult dependent who turns 26 at any time during 2018, they will be covered until December 31st, 2018, and then automatically transitioned off of the plan by ICUBA. You'll receive notification, COBRA notification, and eligibility to continue under COBRA, but you do not have to make any special elections or remove them specifically. It'll happen automatically. Adult disabled dependents are eligible to be covered under the plan over the age of 26 when they are no longer capable of self-support because of a disability, and the disability is documented and approved by SSA or SSI. A note from a healthcare provider stating that your dependent is disabled is not considered proof of disability. There has to be documented disability through SSA or SSI in order to remain on the plan after 26. Beneficiary updates. This is a good time, open enrollment. Log in and check your beneficiaries. Make sure that you have the most updated beneficiary information. The university does provide basic life and accidental death and dismemberment insurance to NSU employees. And the beneficiary information that's listed is the beneficiary information that's transferred to Reliance Standard for that basic life and accidental death and dismemberment. Make sure that your beneficiaries are accurate and that the benefits are used the way that you want and are designated to whom you wish them to be designated should something happen. If you are designating a beneficiary under the age of 18, not a bad idea to contact an estate planner or lawyer and establish a proxy or trust. The ICUBA enrollment portal, just a reminder, all of our benefit elections are made through the ICUBA enrollment portal, with the exception of our retirement elections. Those are done separately through the retirement manager portal. They do not have to be changed during open enrollment. Retirement elections can be made anytime once you're eligible, depending on your employment type. And a quick note on AFLAC, if you do indicate that you're interested in AFLAC during open enrollment, it does not enroll you in any AFLAC benefit because they are individually underwritten. Joe has to write the policy, provide the information to our team downstairs, and then you're enrolled manually and the elections deducted that way. But it's an interest-only designation, not an actual election. That's it for me. I will unmute everybody for any additional questions.